Hi, it's Dr. Martha, and I wanted to talk to you a little bit about lung one of my favorite points that I use a ton on a lot of patients. So, lung one, for you acupuncturists, you know it's over here under lung two. On a lot of people, it's tender because they've got things stagnated in there. Its English translation name is middle palace. Um, I love to use lung one to help relieve emotional stress. We know that for a lot of physical issues like, releasing the breath or relieving coughing or easing asthma symptoms, those are kind of your usual and customary acupuncture point functions. But we also need to think about it. We treat emotional conditions, right? So we need to think about it for things like calming grief or easing grief, letting grief go, right? If a person is really tender there or you feel like it's stagnated, that can be meaning it's grief, old grief that they have unresolved. So it also helps people move through a lot of emotional issues like as again tears, or actually once it's open it can help people. Maybe middle palace partly means between me or a person in their center, their earth, their core can't take praise, and then someone gives it to them and they can enjoy it in their spirit. Lung one helps with that. So, in other words, allowing us to do that, to take in a compliment, helps us improve our sense of self worth. So, kind of that connection between who we are physically and our spirit. Some people say opening it up can bring inspiration, but what I really, really love to use it for is in combination with liver 14, lung one. But I think you need to ground it even more in liver 2, liver 3, pericardium 3, something like that with liver 14, lung 1. And of course, which one would you choose? Because I just named a bunch. You would choose the one that's right with their pulse diagnosis, or you would choose the one that's appropriate with their pulse diagnosis to use along with something like liver 14, lung 1. So, as you know, if you know me, I base every single treatment on pulses, pulses, pulses. So I can't give you a total prescription to use because you shouldn't be doing prescription Chinese medicine anyway. What we want to do is learn how to do pulse diagnosis and take each individual's case on an individual basis in terms of what they need. So anyway, that's just a little bit about lung one, and look forward to seeing little videos about all of the points.